I would say that this is a topic that doesn't really belong specifically to health, to any health professional, because we all touched upon it somehow in how when we interact with people with Parkinson. But I just wanted to highlight, so we will be looking at it from a general team approach, and we hope that you will be able to take something with this, with all the tips. The way I set up the goals is almost the solution for the problem itself, but we will try to focus on really knowing how relevant it is for us to take our medication on time. So I think usually to solve a problem of people having more difficulty taking the medication is them understanding why it is so important for them to take it. I think that would be the first step. And then obviously recognizing that there are common challenges related to the medication in Parkinson. And so if we are able to identify those challenges, and then we can ultimately discuss and think about how to bypass it. So this is just the flow that we'll have through the talk. And if we think about the first one, I want two main ideas to hopefully be shared here with you today about, I don't think the scientific community and the medical community share this enough with people with Parkinson, because it's the relevance of us taking the medication on time is just directly related to how effective the medication will be. Of course, we will be discussing how it's challenging for people to take it on time, how so much can get, how life happens and people might have difficulties in doing it, but what we can expect as, let me see if I can get my pointer here. So not, here it is, okay. What I usually like to share when I am assessing someone recently diagnosed is people usually want to know what's gonna ultimately happen, and I say what the most important thing for you to know is that the medication has a certain time of effect, right? And what we know is as the disease progresses, these intervals between the effects might become a little bigger. The goal of the doctor is so that you don't feel these intervals, right? So that you take your medication, you have a nice effect, it's having effect, and then you go on to the next dosage and you're having effect. So what we all dream of is that we can have the person with quality of life feeling good with the medication being effective throughout the day. Unfortunately, because of the challenges and progressions of the disease, these intervals will happen, and the person might feel like ultimately maybe 30 minutes before the next intake sometimes or less. They might become more rigid, they might become more slow, they might become more anxious, they might even have excessive sweating. So each person might live this less dopamine moment in different ways. And recognizing that this is what happens with the medication, that brings on the responsibility of me being able to take it in the intervals that the doctor has prescribed, right? So keeping this stable means that your brain knows exactly when he's going to have the dopamine so that it can be as fluent as possible. What happens if we don't do it? That means there's lots of research behind this, and the idea is not to go into detail, it's just to really be able to give you these two key messages. If I take it, my medication will work more effectively. It is considered effective for the rigidity, for the slowness. Parkinson is a disease that is well controlled with the medication, right? We just need to take it. Unfortunately, if we have moments where we forget a lot and then we take it and then we don't take it, so that non-adherence to the medication might bring us some motor or non-motor complications. And this is something that's researched. And we want to avoid this, right? We want to minimize this effect. And so by highlighting how important it is for people to take it, we hope that we can convince you to think about the challenges in a different way and to find solutions for those challenges. Okay, so hopefully we've got those two key messages. And now we've got two different concepts that we want to work on. So one is what do we mean by adherence to medication? And let me see if I can get my pointer out so I can move this out of the way. Okay. As you can imagine, the whole scientific and medical community is reflecting about this topic, and in a very summarized way, obviously it's if the person is able to take the medication according to what has been recommended by the healthcare professional. And probably the opposite would be me not taking it means there's some sort of deviation from what was prescribed. And this could be either the timing or the dosages that the person intakes. This is a problem that what worries mostly the health professionals is the fact that most people will hide this problem from their health professionals. And we will also touch upon it because it has to do with the communication and how at ease we feel with our health professionals and our doctors. And I think it's such an important problem, as you just saw from those two notes that I said, the importance of taking it on time, that by not taking it, we have consequences as well. To not be able to discuss with our doctors, it hurts us, right? Let's think about, okay, so if you're still not convinced, what will happen if I do not take my medication? Either I'll have insufficient dose of the medication or we'll have too much. So we can either take, by not taking what was recommended, I can have these two sides, right? So I can have either too little or too much. And there are effects that will happen for one side or for the other. The slides will be available for you so you can go through them, but just giving you small examples, as I mentioned before, if we skip some dosages of the medication, what we can expect is that we will not have the best improvement, the best feeling of an effect of the medication. So yeah, that one's easy for us to understand. There has been also highlighted severe situations where the person, if he stops completely the medication, wouldn't be like one dosage you mentioned. Unfortunately, if the person goes to the hospital, which unfortunately happens too often, and then they're dealing with the infection or they're dealing with the emergency, and then the person doesn't take his medication for, imagine, 2-3 days, right? So these are situations that are more life-threatening, and this is not to scare you. This knowledge should help you to protect yourself from those type of situations. If we have too much dosage, so what can happen if I take too much medication, right? What can I expect? And knowing this again helps me in the case that maybe I don't remember if I took the medication and you take another one just because I'm pretty sure I didn't take it, but suddenly you start imagining, seeing things that are not really there. So this is what we call like hallucinations or psychosis. These things can happen if we are in excessive dosage, which usually takes, if it's not too severe, it's just a question of giving it time so that it can go away. So that, because it's time sensitive, as you could see, and so by the next dosage that should be controlled.
And you'll see the dyskinesias as well too. Those are those movements, those unwanted involuntary movements that show up when you have too much medications, and that can be another more visible sign.
I had once a doctor that I was working with, and he would very highlight that that one of his working strategies was not to ever discuss side effects and negative effects of the medication, which I can understand where he was coming from, which means sometimes we might, by talking about these effects, we might induce what we call a nocebo effect. So it's like when you take the medication, you will believe that medication might do you harm, right? And the placebo effects, when you take a medication and then that is nothing, but it actually has an effect. And people with Parkinson are very sensitive to these effects, and so the doctors are more reserved in talking about this, so we can understand that it not be so common that people are openly discussing, you know what, if you take too much medication, you will have too much movements, or you might see things that are not really there.
Yeah.
What I feel as a physiotherapist and doing home calls and being in the clinic is when people don't understand what's going on and what's happening, it brings more panic. So in my clinical experience, I think it helps to understand what can happen, so that you don't, when something like this happens, you don't immediately enter in panic and go to the hospital, and then we lose control of the whole situation. So that's my position as a clinician.
Now, it's worth knowing about it. Another one that I might consider too would be a blood pressure drop sometimes. Some people have some orthostatic, they have some hypotension, and that could also be enhanced by it. So this is why good communication with the doctor will be valuable.
Yeah. we are all fighting for the right information at the right time, which is extremely difficult to get it right because everyone is so different, right? There's a third, I would say, relevant aspect to this when we don't take medication. There's a social effect on society. What I mean is it really increases how frequently people have to go to the hospital and need more consultations. And obviously this also has implications in costs. So not only for the person, but for our society on its own as well, we can have negative effects of people not taking the medication. This is not something that's only happening in Parkinson. This is a problem that, as you could see, we have a definition from the World Health Organization. So it's seen in many diseases. And I would say lots of problems could be saved if we were able to study this more. Okay, so if we think about, okay, we've had, hopefully the relevance was exposed in a positive way. But now recognizing that why do people sometimes fail taking the medication? Obviously, we can have situations where it's more intentional or not intentional, and that is important for us to discuss. Let's think of, in general, what would be the most common challenges that people would have, and I really have to put this more.
Perfect. Right there, yeah.
The first one that I would probably highlight is how complex the medication regimes are in Parkinson. I'm sure you all agree that it's one of the diseases that most combines so many medication. So I have people that are maybe taking 5 or 6. I've had someone 10 at a time, right? 3 times a day. I had a gentleman that says, I think I'm becoming addicted to these medications because it's almost like eating Smarties or something, right? Which is pretty sad. It's very complex how frequently people take it. So in most common situations, you might start off with like half a pill 3 times a day, most commonly, and then there naturally, as the disease progresses, people will increase into different combinations. Right? When I want to thank everyone that answered the questionnaires, because it was a way for us to get an insight about how you were perceiving this issue as well, and identifying, for example, when we asked people, do you forget to take your Parkinson medication? So either care partners were answering or people with Parkinson, and we saw that I would say very reasonable, almost 52% said no. So most people are being more I wouldn't say responsible, because again, I think when people forget, it's most of the times it's not intentional. It's just life gets in the way. And then we also asked, so in what period of time during the day, identifying the moment that I usually forget most the medication will probably help you try to find a way to bypass it. So also thinking about the timing is important. Here it's mostly in the evening. Lots can happen in terms of the evening, but we will discuss the solutions and brainstorm about how people can bypass these problems in a second.
It's fairly common, I think, for energy levels to go down so much in the evening. It seems like where a lot of the issues happen.
What we wanted to highlight here is just this complex medication. Taking so many medications can obviously lead to more fear of making errors, taking the wrong medication, forgetting to take one. I had a gentleman tell me today, because I was exploring this topic a lot, and he says, I usually put like 2 or 3 pills in my mouth, and then I don't know which ones I have, and I know, but I can feel that I have 3 pills, and I know I should be having 4. And I'm like listening to him, and I'm intrigued about this. As you can imagine, just the risk of taking 4 pills at once. But that's for the speech.
Yeah, from a swallowing perspective. But that everyone seems to be on some kind of cocktail, and that can be pretty complicated. Well, we'll get into that. But.
Yeah. Okay, so when we think about, what would be another one? And as I was mentioning before, really having an ineffective patient-doctor communication, which I think is very hard, even when they're very nice. Sometimes it's very difficult for people to be able to express the things that they are feeling, because sometimes it's time issues. The consultations tend to be short. They have less time. They have to focus on what they can change, what they can treat. And so there might not be some. How often, I would say, how often does the doctor ask you if you're taking your medication, if you're struggling to take your medication? This should almost be a triage and be implied in caregiving, right? I can share with you, if I have someone that comes in the morning as a physiotherapist and he says, my gait is worse today, the first thing that I'm going to ask him is, did you take your medication? Your last medication? Probably the second thing I'll ask, did you sleep well? You see, so I'm going through a whole list of things that we know is the most common things that might happen that will justify that. And I don't jump into, are your muscles sore, right? Because we associate physiotherapy to muscles. This has to do, that's why I say these type of subjects are important for any health professional to know, because independently of what we are treating, we have to have the global picture of what influences Parkinson.
I could even see meds and food or something like that for morning.
Yeah, so what we want to highlight, this doctor seems to be very angry here. She's, but it's just like it's just the expression of the doctor might not be aware that this is an issue, that there are several dosages throughout the day that the person is not taking. What I would send this back to the doctors is how frequently do they ask about it. Now, we have to have a proactive attitude, right? So that's the goal of these talks, which means if the doctor does not ask you, this is something that you should feel at ease to ask. That's the message here. Let's think about another one, which is very difficult to comment on, which would be social economical barriers.
Yeah, and I think this is more of an American issue. Prices in the EU in general, and then in Portugal specifically, are often very inexpensive for a lot of these prescriptions, although some prescriptions are not available. But you get a lot of co-payment inflation, especially for things that are not off of patent, as we say, so they're still only available in their name brand. I can think like Rytary or Inbrija being real good examples. And so those will be expensive. And then also there just might be an issue where you might have a formulary, maybe you have a health insurance that doesn't put certain medications on the formulary or makes you walk through the hoops of taking the other cheaper drugs first before you get approved for the more expensive version. I don't think there are any current production issues, but there was an issue with levodopa production maybe about 2 years ago in the UK, and so that could be part of it, but that's not very often an issue, but it could be. I remember when the Nupro patch was having issues like a decade ago, and they took them off for a while, but that's not that common. I think
what I would expect in an ideal world is that the doctor, I don't know how, but he would be aware of the person. This is where personalized health comes in. So if I really know that person, I know that person is not able to have access to medication A, I can prescribe A, B, or C, but I know the person doesn't have access to A, even though I know that A is the best prescription for that problem. What do you think we should be prescribing? B and C, right? Because this is the option. Sometimes if we think like in Africa, unfortunately, people don't even have access to Cinemet. They don't have access. And so they have to be able to give a response with less effective drugs. So I think it's really comes back to the communication with the doctor and them knowing how far you can go in terms of the medication.
To me, that's almost like a MyChart kind of thing if you're getting the medication, and it seems like you can go into the MyChart and say, oh my gosh, the copay on my Rytary was, $300 or whatever, and they might move into something else or look for other options. The ANOVA Parkinson and Movement Disorder Centers has some information that we can get into later on. Yeah. Again, I think the U.S. is probably the worst culprit for this copayment inflation. Yeah. And it'll continue until we solve that issue.
But even in Europe, we can have access to specific medication, but then the doctor prescribes antidepressants and other medication that are supposed to complement this regime, and then it becomes really expensive. So yeah, I imagine that this can be an issue for people not getting the best applications.
So, Sonia makes a point that doctors in the U.S. may not know what a patient, and I think it's what a patient's insurance will cover. I remember at the wonderful conference that we came in for in April where Dr. Falconer was saying exactly that point. It's not, it's just like the plan that that person has, it's very individualized, and it's kind of the mishmash we have in the US. So
But
again,
would the person know?
the doctor,
No, the person.
when they go to the pharmacy and have to cough up $300, then they're going to know. Then I may not know ahead of time. Now, if you are getting ready to do open enrollment at the end of the year, you can type your most expensive drugs in there, and you can see if they're covered, and that will help you understand that. But again, this is one of these kind of good communication things with the doctor, and then the options, copay assistance, and stuff like that.
And I correct what I just said. In an ideal world, this wouldn't even be a conversation. It wouldn't even be a barrier.
No
So we'd
comment.
all have access to it. Okay, but another one that I think people might have a little bit more control over, which is patient-specific behavior. So this is what we mostly associate to difficulties and adherence. So see if you all agree with this list that we have here. One, this is usually things that people mention, and also it was in the questionnaire. So fear of side effects, very common. I would say that even we have this concept now of levodopa-phobia. People are really scared of taking levodopa with the fear of getting dyskinesias, and this could be a talk on its own. But it's really real, and it has an impact on how people are really taking the medication or not. I have several people that say the doctor prescribed me an antidepressant, but I don't feel sad, so I'm not going to take it. And then they go to the next consultation and they don't tell the doctor that they're taking it. They're not taking it because they fear that he's going to get angry with them.
There was a study we were just talking about last week we were driving back, and it came out just last month in MDS's journal, talking about people who were taking levodopa earlier versus later, and how there was no difference. And I think, again, I hope we continue to tamp down levodopa-phobia. It's not toxic. It's not going to change things.
Yeah.
So it's one of those things.
Yeah, but it's a fear, right? So it's
Oh,
a
yeah.
fear, and then we have other things like if I'm having more cognitive challenges, so remembering to take the medication becomes more difficult. If the person, even people that tell me the reminder goes off and I know I have to go take the medication, but I'm just finishing something, and then I totally forget that I have to go take it. So this is very common. It's the most common thing.
I have a friend that I got onto a call with, and we get nerdy about tech, and I'll listen to when we're talking, and I'll hear a little whoop, and then about 10 minutes later I hear a whoop, and I'm like, is that your medication reminder? And he's like, yeah, I'm just getting into the conversation, and it's real easy to do. You gotta be careful about it.
And then obviously this being more challenges in cognition also might bring on more mistakes in how we take the medication as well. So I think that's important. And then having more side effects on that. Then we have things like depression. Depression is something that really impacts quality of life, any activity. So the person really is unable to do normal functioning when it's really severe. So let alone take the medication as well. Difficulties in swallowing. So all these problems we're going to touch upon now, thinking and reflecting about solutions. Then patients' beliefs and preferences. So maybe things that I might want to now take and not take, and the expectations that I have that this might be important for the future. Obviously, our access to knowledge is also identified. If I have more access to knowledge, I will understand the relevance better. I might adhere more. And then I think the worst one, which is really mistrust in the clinician you're working with or the health system itself. So when you think someone's just giving you that medication because they want to get money, that's really affects our trust in the system.
I would probably add a couple to this list. In particular, denial. I would put there, it's similar to what I might see somebody say as an occupational therapist. Well, why should I why should I start sitting down to put on my pants? I've always done it this way. And you think, well, I've never needed this medication before. Why should I need it now? I think I'm doing fine, which leads me to another one, and that is not really being able to accurately assess the effects of medication. Sometimes people don't realize how helpful the medications are until they're not taking them. And even sometimes then it's their care partners who recognize that things are really off and they're like, did you take your meds? What's going on? So I think there are a few other things like that that can lead to and actually increase the denial.
Yeah, no, it's a good point that you raise up there. When I was showing the graphic, that remember what we want is the person starts taking the medication, he gets the effect, he feels good, and then you on what's supposed to happen is you don't feel the need for the next dosage, and so this might bring on this. I don't feel the difference? Why should I be taking it? Especially in earlier and young onset and in earlier years of the disease, the person might forget more often because they don't feel that effect. And usually what I tell people, but that's good. What we want you is for you not to feel that effect, right? Because if everything's okay and it's stable, you just having the level of dopamine stable, that means you're not supposed to be feeling that effect. So it's important to tell people that so that they understand that that is the normal, that is what we want. But
Yeah,
it's
I think along with that goes the idea that these meds are timed in certain ways, and it's very specific what the doctor is trying to do in order to keep you at the most level ability that they can, so you don't have those drops or the drops don't last for very long when you're off. And so the timing, I think a lot of times people don't realize just how important the timing is that the doctor is trying to work out for you.
And I think there's some acclimation to your system too. So you're actually training your system a little bit with that on top of it. Part of the method that the doctor's using. Someone is just putting in the chat here, like someone who went to a narcissist in the hospital telling the patient they don't need the meds because they don't have a tremor, and maybe the patient is doing well because of the meds. And I'll say, first of all, 40% of people with Parkinson's don't present with a tremor, so that's not a great metric. But hospitals, for sure, you need to be good advocates that you're getting the right meds. And again, the ANOVA Parkinson and Mood Disorder Center put together a great document on their website where they really highlight that. So if you happen to go into the hospital, it's an upgrade of the one that I think the Parkinson's Foundation did several years back.
I would almost say that the hospital in adherence of medication in the hospital could be a talk on its own.
Oh yeah.
Because so many things happen sometimes in the hospital in these type of situations, health professionals that are saying, yes, of course I know Parkinson, but I can only give the medication according to the hospital schedules. And then the family saying, no, but you don't understand, he has to take it 44 hours. And no, so there's a lot that can be discussed that I think we should think about doing a talk then on it.
One more question here, and
Yeah.
I'm only going to bring it up because I don't know that we're quite going to get to it, but another great one is, will you also discuss how to time Parkinson's medications along with unrelated medications for diabetes or statins or heart? And I feel like this is a real doctor kind of, it's above our pay grade a little bit. So these are the kind of things where if you have different doctors, you have a cardiologist that's talking about your cardiology meds, and then you have a doctor that you'd be talking about your rheumatology meds.
This goes in line with what I was saying in the beginning when I said that person has like 10 medications to take. It's not 10 from Parkinson.
Yeah.
It's for blood pressure. It's
Oh,
for
yeah.
diabetes. And everyone tells him to take it in the morning. And so the person has 10 pills that he's taking in the morning. Do the doctors talk about that? Again, we talk a lot about multidisciplinary team, but being able to put all the doctors talking to each other and how they can spread out the medication would be an ideal scenario, which unfortunately I don't think it happens. So the person has to do that. I think really going to the consultation and showing this is what I'm taking in the morning. This is so they can get a big picture of it. Might help so they can see the quantity. If I'm taking 10 pills in the morning and then 5 pills in the afternoon, how can I spread this one to a different time? Although the trick is they do try to put everything in morning, lunch, and dinner on purpose so that you won't forget. But I'll come back to that one in a second.
I do want to say though, I mean, in that area,
Yeah.
For your Parkinson's, the movement disorder specialist is probably going to have the most knowledge. It would be great if they had a cardiology team nearby or someone they can consult or they can reach out to the office. But in a pinch, if you had to ask one, I would start with my
Yeah.
movement disorders neurologist, because they're going to know how Parkinson's impacts a lot of these other areas. It might not be the same. It's because all they see is Parkinson's. It might not be the same for an enterologist or a cardiologist, although
Yeah.
anything's possible.
But I have seen cases like
Sonia just said the same thing.
blood
Yes,
on,
I agree with you.
like imagine a blood pressure and then taking it in the morning or taking it in the or at the end of the day. If it's possible to take at the end of the day because your cinnamon already provokes low blood pressure. So I think there are negotiations that happen and it has to be studied out.
And we have two questions that I've seen about protein, and then we'll get into that later on. We have a slide about that, so that one we are
So
covering.
one more slide on problems, and then let's focus on solutions. And
Yes.
everyone, please, you welcome them to
Love the questions.
to
Yeah.
unmute and express
Yeah.
the questions with us.
Yes,
So this
great
was
minds.
actually from the questionnaires, which was we asked everyone what was your biggest challenge dealing with medication intake, and the answers were that, for example, one was not wanting to take the medications. We don't know the reason why. So if it's related to cognition, it's a different strategy. But if it's related to not really understanding why I'm taking it, hopefully we already have covered that. Then we have the side effects of the medication and the timing of the meals, which we will also touch upon. And then another person said timing it, balancing Parkinson requires with diabetes requirements, which was in line with what we were thinking before. It's like, what about all the other diseases that I have to also handle? Then we had frequency during the day. That is one of the problems in the complexity of it, that people have to take frequent dosages. And then mostly about forgetting. So it would be remembering if I took it or not was an issue, confusions probably of the medication, general forgetting, remembering to take it on time, another person remembering to take some in my purse. I now have a small pill box I keep in my purse. I now have, so that's the strategy the person's sharing. And then distractions, busy doing something else, and unaware of time. So hopefully that all goes in line with things that we were mentioning before.
Of course, I live in the land of ultra athletes out here in Boulder, Colorado, and I've seen people really push themselves to, say, go on a very, very long hike and take the same amount of meds that they normally do, and they crash in the middle, and it becomes quite problematic. I've also seen people show up for class and they just feel like, after they've been exercising quite a bit, they need more meds, and it's like, does anyone have any extra meds? And all the hands go up, and not a good plan. Not a good. Your meds are your meds. Their meds are their meds. You got to keep them separate.
Sure. Yeah, yellow pills and all.
Okay, so now if we really try to dive into what would be practical tips that either people are doing. So this type of knowledge, unfortunately, I did not find an article that highlights this. As I usually say, it's interesting to see talks where we spend the whole time talking about the problem and then the solutions is only one slide. Obviously, we hope not to only say what is obvious, but if we identify what is the challenge and what can we do about it. Our first challenge that we mentioned was complex medication regimen. So we have lots of medication that has to be taken in frequency throughout the day. I can highlight that this is a subject that is highly studied, especially when new medication come on. They actually have to try to test the adherence of people taking those dosages. So when you have like medication like opicapone that's once a day, and I would say they had a great benefit of that because it's once a day. Everyone can adhere to that versus another one that you have to take 3 or 4 times a day, and you still have to do additional testing. So this is something that's really studied by the pharmaceutical companies in order to make it more effective. What we think, I'm like, okay, so is there something that I can do about this as a person with Parkinson or family? If we have a nice relationship with our doctor, I would say that asking the neurologist to simplify, because you imagine you're starting to have difficulties in being able to comply with the different medication. So they might sit down and they have many options that they can probably choose from, and maybe work out a strategy with you of having less frequency or increasing the dosages on one so you don't need so many. Obviously, this is not easy because it's already a challenge to just get you to the right point. And then any changes will always come with some effort. but it's better to negotiate something that works less good than not take medication at all, right? Or people failing frequently.
I think the combination pills are a really good option here where the doctors may know all the options. I saw Dr. Falconer actually present in Copenhagen on a combination that was using a very low dose of pramipexole with a long control once a week release of rasagiline. It's Azilect. And so that's a nice combination. Or you were mentioning, picapone. In the United States, entacapone has to be taken with every dose of Sinemet, and they have a combo pill that's Stalevo. So the doctor will, again, a movement disorder specialist especially, will know some of these tricks and maybe have ways that they can rejigger your medication regimen to make it a little easier.
And I think that's a really important thing to say. It's the movement disorder specialists are going to be the ones who are likely to be the most up on the most current medications and all the different kinds of combinations that they can try. So it really is to your advantage, and I know I'm speaking to the choir here, but it really is to your advantage to find a good movement disorder specialist who has had a lot of exposure and practice.
Yeah. At that same conference in April, I remember Dr. Falconer's like, we have 28 new options for this, and it's like, that's not the way it was even 5, 6, 7, 8 years ago. So we're preaching to the choir a little bit.
Yes. So I think another thing that sometimes we don't think often is like the doctors keep prescribing, and here it's any doctor keeps prescribing more and more medication, and just thinking about once in a while really stopping to think and reassess, is there any medication that I can stop?
Yeah.
In the risk of fall, which is curious, I might be in mistake. I can't remember if it was 8 or 9 medications. If the person was taking 8 or 9 medications, they placed him at risk. And this in Parkinson can't be effective because people are taking much more than that. So it's just worth once in a while just stopping to look at all the medication that a person is taking.
Yeah, I think the term is deprescribing, and I think it's something that's very much in vogue. So yeah, it'd be an easy conversation to have with your doctor, I think.
And then another thing that we can really reinforce is being able to discuss a moment of non-adherence. So it might not be so intuitive that you think about this. I'm going to take 5 minutes of my consultation to really talk about this problem with the doctor. I'm struggling to take the medication on time, specifically in what moment and why, and things that you've tried to bypass it. And I want to highlight with this slide, there's a lot of scientific literature showing this.
Hold on, I'm looking for it. Give me 1 second here, please.
And so I wanted to tell you that the doctors know this. Okay, so it shouldn't be a barrier for people to be openly discussing this with them, because they are well aware that simplifying the medication regime will improve the adherence. Okay, this is something that is really highly researched in many areas, not only Parkinson. Then this is actually a picture from one of the people that I work with, and he sent it to me and I said, well, this is an interesting way for you to be able to use your visual memory as well, and will reduce errors actually. So I found it fascinating that the person actually placed this, and what he does is just he places this in the fridge so that he and his family will always know which medication he has to take. I think knowing the color of the medication, knowing the names can be tricky, but knowing the colors and the dosages, this type of information that very often people with Parkinson might delegate to their families, the care partners, it's worth doing it even as an exercise. It's something that will protect you by knowing this. If you happen to have an incident and you go to the hospital, this is very important for people to be able to do this under pressure. So I would use this as an exercise for myself, knowing exactly how the medication look like so you can reduce errors. Another thing that I dream about is actually there's already medication for heart disease in the shape of a heart, which I found very, very intelligent. So the person might be dealing with more cognitive difficulties, but he will visually already know, oh, this is for my heart condition. So in a ideal world in the future, maybe we can have little brains to help us distinguish the medication in Parkinson.
I went
I had
through
a crazy situation once where it was a couple living together, one with Parkinson's and one not, and they mixed up their meds one night, and it was not good for either one of them.
If it's the same manufacturer, we ran into this one time too with my sister when I was in college. And if the manufacturer is the same company, it's like they can look exactly the same. It's just have a different number. So yeah.
Okay, so I think just highlighting color, shape, and remembering what type of medication, I think empowers you to defend yourself from errors. When we discussed about ineffective patient-doctor communication, again, I want to highlight these are things that are studied. The professionals know that when there is good communication, they are able to identify this. Like, I think a doctor will appreciate to know that the person is having troubles keeping up with the medication, because he wants to do a good job, right? At the end of the day, we want to help people, and we must be aware of the problems to be able to help. So again, reinforcing, if this is possible, to find a nice doctor that you can talk with. From our questionnaire, we asked if the person thinks that you might have side effects due to the medication, what would they do? So if the doctor prescribes us medication and then something happens, what we saw is that the majority of the people said do nothing until I talk to the doctor, which might be the most common one. And obviously you can say depends on the side effects, right? And then we had other people that said, ask other people with Parkinson. This is more common than you would believe. I participate in several groups where I'm part of groups with people with Parkinson. And I usually say the most powerful, convincing element to be able to convince people to change behavior is peers, is other people with Parkinson, which could be positive and negative. So if someone says, the doctor just prescribed this medication, and then someone in the group says, oh, I took that, it was horrible, I vomited, I know it, and starts talking about what a negative experience they had, this will enhance that nocebo effect that I told you about earlier. So the groups are relevant. I think in the part of the medication, we are still going to identify this as a future problem. Okay, so what I wanted to really share with this is really to consider asking, when a doctor prescribes some medication, it is helpful for the person to consider asking them what it's for and what can you expect from it. And this goes in line with what I said earlier, that some doctors are not comfortable about talking about side effects. I don't think we expect the doctor to be making a list of all the side effects that can happen, because that's not going to be positive for anyone, as we can all agree. But just general things like, you know what, if you take maybe the cinnamon, it might have some more sleepiness, but if you think that it's too severe, please contact me, right? So I think there are one or two things that we know about specific medication that happen that will ultimately be more positive, more productive or more effective if they do share that with the patients. So I think they should be challenged more often, and people should really ask, okay, what is this medication for, and how long can I expect an effect, and if something should happen, how do I contact you? Does that sound okay?
Yeah, and it
might sound obvious, but some people really don't think about this.
Well, and some of this is my chart, sending a message. So talking to the doctor, you can call in as well, but it's just as easy to handle this inside of there if you have that option. So it's not necessarily not until I talk to my doctor in person at the next appointment in 6 months. That's not what we're talking about.
Yeah. So because so many people said, I do nothing, I just want you to be cautious about knowing when to not do nothing. And it's 6 months, 1 year after you're going to the consultation, and you still have the problems, or even worse, right?
Yeah, for sure.
Which brings up another issue, and that is, how frequently do you see your doctor? Maybe those visits need to be more frequent, especially after a change of medication or a problem that you're really trying to address.
Yep, great point for sure.
Okay, so just reinforcing what we were saying, that we do know that by educating people about their medication, and you see the talks, you have a wonderful talk by Dr. Falconer about your medication. It's a program that's ongoing. If you haven't gone to it, I'd really recommend, because if you get to know this, you get to know what the medication are for, what is the benefits, you can defend yourself better.
Yeah.
Okay, so we did take 2 or 3 questions that people added into the questionnaires. Unless there's some other question in the chat, we will cover these now.
Well, this just actually came from a person in our survey, and they talked about a doctor that's gaslighting them. That means telling them that they're not, what they're saying is not credible, or it's in their head or something like that. And that's really bad. That's a really bad bedside communication. In that case, you can always advocate and say, I understand that you disagree, but this is what I see, this is what I feel. Those are valid. But if you're thinking that means that you're not having good communication with the doctor and you want to look for another movement disorders specialist, and again, in the Northern Virginia area, you guys have an embarrassment of riches there. But the Movement Disorder Society has a directory where you can just look up in your zip code. I think before I would do that, I would ask people in my group, if you're at a support group, or if it's at an exercise class, or you're at an event with Sonia or whatever, just get recommendations from other people with Parkinson's, because I think they'll give you quite good reviews. Yeah. Someone's asking me about the protein again. Don't worry, we will not forget
Okay,
you.
we're going to go. So thinking of challenging forgetfulness, the most typical one is to associate it to an activity. And I put this one on purpose because I just had a gentleman that was telling me his gait was worse, and we identified that it was just because he was forgetting so many medication dosages. And then he was like, I usually forget the one in the afternoon. I said, is there something specific that you do in the afternoon that we can associate your medication to? And he said, I do eat my chocolate, and I do not forget ever to eat my chocolate. And I said, perfect. Then we found the solution. Just when you take the chocolate, take the medication as well. So this can be very personal to you. Sometimes it's 5 o'clock tea. It could be whatever, right? What typical is the doctor will prescribe, at least in Portugal, and I see it all over as well, which is eat it at lunch, at breakfast, lunch, and dinner. It's usually the most common prescriptions. And John will go into maybe people should reconsider those strategies. But the reason why the doctors are saying that is so that you can associate it to your meals, and so it's easy to remember. The next one is, I would say, a little bit the obvious, but actually this gentleman that I'm talking about, the chocolate, he said he struggles with his, I said, but don't you have reminders on your phone? And he said, yeah, I struggle a lot. He's 80 years old. He has difficulty struggling with the phone. So it's either getting help from someone to help you use this type of prompts, right?
And this is the easiest way to do it if you have a calendar feature that you can access. If you know how to set an appointment and you make it a recurring appointment. My only caveat, I wouldn't be necessarily putting granular information in there, because these calendars are usually web-based, so they're going to have cloud, and there's no other features to them.
Okay.
Apple actually, inside of it, actually has built-in tools in their health kit, and then you can just search for health in Apple and then go to the medications, and you could set those up there. And that's also nice. It's not Parkinson specific, but it's valuable. Android actually doesn't have an analog to this. They recommend using the Google Home device, and I'm not sure I would do that, just because, again, it's very cloud-based and it's personal information. Apple is very specifically does not encrypts all this data and is not available, so it's pretty secure. There are apps out there as well, but my caveat is I really don't think that they're very Parkinson specific. And over the past 3 or 4 or 5 years, there's been a real explosion of apps made specifically for Parkinson's. And I just listed, I won't go through each one of these, but I've listed ones that are free to the public and open, including My Moves Matter, which is made by a person living with Parkinson's. It's pretty cool. And then ones that you actually get a prescription for. And that's another interesting thing that's not going to be, we'll get into that more in another presentation. But I would just say, if you're going to use an app versus the native tools, the tools built into your iPhone, consider getting one that has been made for people with Parkinson's. A lot of them integrate with the Apple Watch. Again, smart speakers can certainly do this, and if you have an Android phone, that's what they typically recommend. just make it fairly generic. And if you're going to use the speaker in your home, be sure that you turn on the app reminders for the app in your phone so that it works when you're outside of your house. Otherwise, it'll only work when you're sitting there. And yeah, this is.
And then people that count obviously on who they live with. So either family, friends, just having someone. Imagine like at 5 o'clock, you usually have an event where you're with a specific group, and then it's friends, and so you can ask specific support from those people, right? So thinking about that is usually the most common one that people use, just depending on others to remind them. And there is obviously a specific therapy to change habits if this is a really severe problem. And I would highlight these are strategies that people used in that you referred to. So using things like pill box, the person noticing that the numbness in the feet reminds me, so the person starts feeling the symptoms, and so, oops, I didn't take my medication. But the most logical ones that you see here are the timers and the alarms, right? There was a question about if I do miss my dosage of medication. The first thing I would answer to this would be discuss with your doctor what is his strategy for this, because people might have different opinions on this. Obviously, this should be recommendations, but the health community is not at complete consensus on this. So if I do, it depends on the time that has gone by. There's a rule of if it's still within a window of 1 hour. This is specifically for Portugal. Then the person can just adjust the medications of the next intake. But again, I think the best answer for this is just really discuss this with what your doctor prefers.
Especially because the meds could be very specific, and this might also, if you're traveling, this might be another kind of in that same boat. So when you land somewhere else in a different time zone.
I think the obvious one is just don't take 2 pills at the same time, right?
Yeah.
And then obviously the swallowing difficulties of medication that we wanted to cover.
Yeah, and I think what we call pill dysphagia, pill swallowing difficulty, is pretty common, and so about a little bit more than half are expressing some difficulty, with almost a third of these individuals having pretty significant difficulty. And I think that, I read that wrong, I'm sorry. Less than that third having some significant difficulty. It's one of these things where this is a great reason to work with a speech language pathologist, but in the near term, there are some tricks that you can do. And I think the easiest one is to get out of the habit of taking a pill and then taking a sip of water and then trying to move this hard, solid object in your mouth while you're navigating a bunch of liquid, which goes whichever it wants to go. It's a path of least resistance with liquids. And so it's great after you take your pill to take a nice glass of water. It helps it work better. But what I usually tell people to do is get a nice puree, like applesauce or a mashed up banana or even something real soft like that. And you put your pill right in there and it helps it go right down. Just be careful of protein-rich purees because, as we'll talk about in a moment, protein can sometimes interfere with your Parkinson's meds, particularly if it is Cinnamon. Some pills you can crush if you have pills that are not the CR or the XR, which is the controlled release or the extended release versions. So you can crush them and put them into an applesauce and make it easier. They do have some dissolvables, not a whole lot of them. I think Sledgeling has one, canned pumpkin, and then patch and pump formulations can also be something to consider. The pump is still getting held up by the FDA, but it's coming soon from AbbVie.
I would just highlight the crushing of the medication. Please do discuss that with your doctor, because it will have more a quick effect, so it might last longer.
Time. Yeah, won't last as long. It could hit you harder. Yeah. And I just want to put it in here. It's great. The canned pumpkin as a puree can be a nice one if you like the flavor, or you can sweeten it up. So, okay.
And if you have eaten protein, I know a lot of people say, "Oh my goodness, I ate protein. I can't have my pills now because they won't work." They will work partially. They just won't work as well. So you still need to take them, but try not to combine them with protein is the idea.
And the caveat with that too is that it's not universal. Your experience will be different. Early on in the first few years, particularly, I remember one study saying that something like 17% of people were having issues with that, and it wasn't common. If you have a half dose or like a person that
I was gonna push you guys here.
Yeah, let's do that. Yeah.
And just for time's sake, apologize.
Yeah, we're looking at it.
That obviously we did consider that person having difficulties with the diet.
Yeah.
And this is what you were mentioning about the effect that it might have.
And again, what Nancy just said, right? It may have some influence. It doesn't mean you shouldn't take it if you've made a mistake. But as you're planning your day, you can try to take your pill at least a half hour. Often I hear an hour before or 2 hours after. You might take less protein in your diet until later in the day. You might load the diet a little bit later in the afternoon. You should not cut protein out of your diet because it's very important and you will get very sick without it, muscle loss.
This could be an extra challenge if you have more frequently intervals like 3 and 3 hours. It does happen. So
smaller meals then, more frequently, snacks. And then yes, water with your pills, but not as a way of chasing the pill down. So again, after you take your pill in there, a nice 8-ounce glass of water will definitely help with the pills. It will also reduce constipation along with your canned pumpkin.
Which ultimately will make the medication more effective.
Yeah, for sure.
Because it's absorbed better. So we did have some questions. Should I take my medication with food on empty stomach? Hopefully we've answered that question already. There was another question about drinking alcohol.
I do want to say that if you have nausea when you take your pills on an empty stomach, then some like saltine crackers, something that can give you a little bit of food can help. But again, avoid things that have a lot of protein. Alcohol and medications, again, talk with your doctor, but generally speaking, alcohol is not going to benefit your medications, particularly if you take medications that let me leave that for doctors. There are certain meds that you definitely do not want to take with alcohol. I would put in here too, you didn't ask about it, but medical marijuana could also influence these, and these are things to talk about with your doctor. Same thing with supplements. So make sure your doctor knows not just what prescriptions you're on, but anything you may be taking recreationally and anything you may be taking as a supplement.
And when we say talk to your doctor, it's because it will be personalized to you, because they will, when we don't have consensus about exactly what recommendation to give relating to a certain topic like this, like alcohol, so you will find research studies that say in favor, research studies against it. You will find doctors in favor, you will find doctors against it. So because we don't have a consensus, it is the best to see it's your relationship that you have with the doctor and see how he thinks about it and how it makes you feel. Another important topic, and we apologize for the time, is really people struggle sometimes to take the pills out of their medication box. This is a gentleman that was struggling so much, and then identified that it was cut up so much. If you guys see, it's like
each one's individually wrapped, and then they cut those little wraps into.
And I see it, but this makes it harder for you to be able to take it out. And he said, yeah, talk to my wife. She's the one that cut them. So it was, I can understand what the wife was doing. It was just cutting them up so that they would, so that they could fit inside the box. That was the goal. But actually, it was bringing on a problem.
Yeah. Some people talk about putting their pills into little plastic bags, and that also works very well. As long as you have access to those. There is a company out there that does something called called Pill Pack. They got bought by Amazon, and they'll actually take your prescriptions and individually wrap them and timestamp them, and that can be very convenient, especially if you're heading out for a day. However, one problem is if your doctor's changing your meds with any regularity, you could have a lot of waste, and I think that's been the knock on Pill Pack is that it can result in a lot of leftover pills. Because once they're in your house, you can't be like, oh, hey, will you take these and trade them in? Once it's in your hands, they can't take your meds back. So be careful about that. There are some options here. These are all automated systems. Typically, you'll have a nurse load them, and then they would remind you, and they would basically check your compliance. This is not something that I would do casually. This would be if I've had some real issues or if I'm dealing with this alone and maybe need some more extra help. And a lot of these are covered by Medicare or at least have some copay support.
That's wonderful.
Yeah.
So this is a little bit of Nancy's world, but it's about the handling, right? If you it's
Yeah.
bigger, you can probably use it better.
Yeah. Yeah.
And having someone help you with your med boxes, hopefully you've got one that really suits your situation, has the right number of compartments for each day, and you can take out a day at a time. Perhaps that's the best for you. You put it on the counter. You can see if you've taken your breakfast, lunch, dinner, and evening ones. Those are really nice. So there's lots of different options to look at. You can find them in the pharmacies or online. If you have someone who can help you to organize those, to just kind of be a second set of eyes as you're divvying out the pills, I think that's always really helpful because it's easy to make mistakes when you're dealing with that many pills. I really like the idea that you talked about earlier of having a cheat sheet that actually has the real pills on them to show when you take what, and you put that out in front of you as you're divvying up your pills.
Yeah. And if
Also, the other thing that people find is, just getting the pills out and getting them into their mouth. A lot of times that's tricky, and sometimes it's easier just to dump them into a tray or a bowl or something where they're not going to fly around, and put something sticky on your finger and just get them in like that, as opposed to trying to pick them out, and that's sometimes really hard to do.
That's a good idea.
I recently had someone go into the hospital, and I would just highlight that take the boxes of the medication, because it's the people already struggle to accept for the hospital to accept the medication that you're taking. If it's in pill boxes, they won't know what it is, or they'll be challenged by this. So take the original boxes if you go to the hospital.
Yeah, the pill containers. Yep.
Yeah, the aware and care kits, but I think you were mentioning something that, Sonia, you have at your facility,
Yeah,
that helps.
they're not doing the aware and care kits anymore. They've stopped that. They're providing some information for it. I think they've got a book now. But yeah, the actual kit itself, we're on our own for that now. We have a hospital handout. It's a letter with basics of Parkinson's and some of the basic medications and contraindicated medications, and information that about medications that are acceptable or are good for Parkinson's, and also our contact information. And it's for anyone, not just people in the ANOVA system. Then they're welcome to contact our neurosciences 24/7 number if they have any questions. But that's for the medical providers in the hospital to call us, not for the patients. We can't contact the hospital or the rehab, but they can contact us, and we can answer some general questions, like if they want to give the patient Haldol. We can help by offering other suggestions, because Haldol is really not good for people with Parkinson's.
Yeah. I've had people who will put all their information on a thumb drive and have that with them at all times in case they get in a car accident and end up in the hospital. They've got it with them.
There used to be a great little a wristband where it was a thumb drive, and it would fit in there. My only caveat, and I don't know what it's like at BCH, but at Life Care, any foreign thumb drives got shut down. So it'd be good access if someone could bring it, like you have your own laptop or your spouse or something, but a lot of networked computers at a hospital, which just won't let a foreign thumb drive. That's actually how we got Iran with Stuxnet back like 10 years ago. We dropped a thumb drive in the parking lot, and they did that.
And that's all about hospitals. I will also say that if you're traveling, just make sure and take extra meds in case you get stuck somewhere. Have your meds with you at all times, not in your luggage that might get lost.
Okay, so we hope it was useful, and at least reflect on some topics.
Yeah.
Remembering is understanding why, I think, helps people think about how to really tackle the challenges. So
Thank you.
Thank you for coming in, everyone. Have a good evening.
thank you
Thanks,
very
guys.